Hey folks, I'm here with Dean Jana Lynn Patterson and Dr. Ginette Archinal. Thank you both for joining me. Of course, we're talking today about how to protect yourself from COVID-19. So first, Dr. Archinal, I'll start with you. When it comes to personal precautions, what kind of precautions should we be taking?
Well, the interesting thing about the COVID-19 or novel coronavirus, which is the other thing people refer to it as, is that the same precautions are what we would use for the flu, and on a university campus, mono, strep, oral herpes, any of those things. It's spread by droplet spread. Wash your hands and wash your hands properly. Use hand sanitizer properly. Don't share drinks. Don't share lipstick or lip balm. Don't touch your face. Don't scratch your face. You touch a surface, then you itch your eyes or your nose. That's how you spread infection to yourself. Somebody coughs, opens a door, you then open the door after them, then you push your hair back off your face. That's how you infect yourself. If people just think, this action might give me the flu, or this action might give me mono, think about, okay, that same action may give me COVID-19. And it's really that straightforward. Not easy to do, but it's that straightforward.
Okay, so Dean Patterson, from a public health standpoint, what should we be keeping an eye out for?
Well, I think certainly following the advice of reputable sources, the CDC, the FAQ from the university, which is vetted to make sure that it has the most accurate and up-to-date information that we can provide, following the advice of our medical leaders on campus, and also just thinking again about how their behaviors in the residence halls and social environments, again, might spread the virus. So we're asking people to be hypervigilant about that. Certainly while they're away on spring break and when they return or wherever they're going to be for the 2 weeks after. But really to just think about, could I be spreading any other virus to someone else? And to think about populations that may be vulnerable, that they don't have, that they don't think about on a day-to-day basis. Grandparents, we do have other students who have underlying medical conditions and immunocompromised conditions that are at higher risk. We have some faculty and staff that students may not be aware that there's a medical condition. So just asking people to be hypervigilant, not to panic, to stay calm and to stay balanced, but to really be thinking about, could I be infecting someone else?
And Dr. Archinal, back to you. What should a student do if they're feeling sick?
Well, the first thing is, don't assume it's COVID-19. Just because COVID-19 is around doesn't mean you can't get everything else that's normal as well. So treat it the way you would a normal illness. If there's anything about it that's different from your normal, particularly if you get a fever or you've been exposed to somebody who might be at risk of COVID-19, if you've traveled somewhere where your risk might be higher. But basically, if it's just different from a normal cold, call the doctor's office, come into student health. If you really are worried about COVID-19, you should not actually just front up anywhere. It is better to call ahead, be it at home, be it here on campus, be it going to the emergency room. And that's just, again, as Dean Patterson was saying, to protect people around you. Because if people know you're coming in and there's a potential risk, just as we did on campus with mumps, we can make sure that when you come into the waiting room, you're taken back to a more isolated room immediately so that everybody else around you isn't infected. And this, I think, is really such an important point that Dean Patterson made. This is not about us as individuals. We are all part of this. And we have to think about the impact of what's going on with us on other people, far more so than we would with flu or mumps or anything else where people may have been vaccinated and therefore it's not going to spread as widely. None of us have antibodies to this COVID-19, which is why it spreads so widely. So it's really an important time for us to think not just about ourselves, but about everyone else, which really is very much the Elon way anyway. So I think we just need to translate that to how we approach this.
That's such an important message. And Dean Patterson, faculty and staff obviously could be concerned about these things as well. What should they be thinking about?
Well, I think the same parameters is that if they begin to feel ill, or they begin there's someone in their family, to follow Dr. Archinal's advice, but also not to come to work sick, because again, they're not only perhaps infecting their students, they're infecting their coworkers, and they're infecting. And we have visitors on campus. So again, that's a very widespread, the possibility of spreading it is much greater even than the flu, because there's no vaccine.
Yeah.
And so we really want faculty and staff, again, to be calm. Certainly the university has, over the next 2 weeks after spring break, will be giving faculty a chance to test out online teaching and learning, and so that will give us a chance that if there were to ever have to be any other changes made, that we're better prepared. But that we have every expectation that right now that when folks come back in April, I will say though that when students come back for on-campus learning, they still need to be vigilant.
Oh,
I think
absolutely.
Folks think we're getting some feedback that folks might think that, well, if we come back in April, it'll be over. I don't think it'll be over, but we certainly want people to continue to practice just good vigilance.
All right. Well, a lot of things to keep in mind over the next few weeks. Well, Dean Patterson, Dr. Archinal, thank you both for coming in.
Thank you for asking us.